Hi there, Holistretch fam. Welcome to this Holistretch video. My name is Frances Eve. Nice to see you guys again if you've been following. If not, hit the subscribe button below so you have access to all the Holistretch videos and know when they're freshly posted every Wednesday. Today we are going to be doing a video on preventing knee issues or knee pain with foam rollers. I am passionate about this subject because I consistently get clients who have knee issues, whether they're playing a sport like basketball or they're sitting driving for long periods of time and they start getting tight in their knees. I personally have experienced knee pain from hiking downhill every once in a while if I don't foam roll my quads enough. So what I have discovered through these experiences of seeing people in pain with their knees is that for the most part, they're not foam rolling. I do hope that this will support you. If anything, you're gonna do nothing but good because what you're doing is you're going to be softening the muscle tissues around the knee. When we look at the anatomy of the knee, we see that we have the patella, which is like the bony structure encapsulating the knee. We have the femur, which is the thigh, so that's what goes up. And then we have the tibia that goes down, that's the shin bone. And what we focus on when we focus on foam rolling are the muscles around those bones. I hope you have a foam roller with you. If you don't, you can use a canteen. Like if you have a water bottle, it's like a canteen. I've used a canteen before. They work just as good. They work just as well. They're just a little bit, you know, they're a little bit harder, a little bit firmer. So they can be a little more painful. The firmer you go, the more painful it's gonna be. So if you feel a little bit nervous about foam rolling because you're afraid it's gonna be really painful, get one that's a little bit softer. Get like a softer foam roll. These are the ones, this one I recommend the most, this kind of foam roller, just because it has little divots. It has a natural, nice little curve for your leg. And I will leave links to my favorite foam rollers down below, but this one is sort of a medium firm. I mean, when I press down, it doesn't press down. So that's how firm it is. It's honestly pretty firm, and that's what I really love about it. And the little indents can move into knots in your body, knots in your quads and your hamstrings. So it is really nice. This is my favorite foam roller. Next to this baby, this is my other favorite foam roller. This one's so awesome. Seriously, if you have knots like in your back, your neck, arms, things like that, this one's epic for knots. You can look at it this way. You can see all the divots, like how deep those divots go. These divots can go real deep into those knots and mess them up. So I really recommend this one. This one's gnarly. So I wouldn't recommend this one for your legs. I mean, personally, I don't like to use this one for my legs. This one is my baby for my upper back. This one is my baby for my legs. So I have two different ones depending on where I'm using it. So you can do that as well. If you have a really, really tight area, get a softer foam roller. If you have a really, you know, area where you can take a little bit more pressure, like for me, it's between my scapula, my upper back, I can take gnarly amounts of pressure. So I will always use this one. Another recommendation that some people really, really love are the vibrating foam rollers. So there is this one. It vibrates like this. So you have all these different levels. This one's a Theragun brand, but this one is a vibrating foam roller, which is kind of nice because it does work on your body on a little bit more of a subtle level. So if you don't want to really, really foam roll deep, you just want more of a subtle sensation, you can get a vibrating one. So go ahead and grab your foam roller and we will get started. Hi, Holistretch fam. All right, let's go ahead and start by sitting down on your sit bones. You're going to bring your foam roller underneath your knee, the top part of your knee, and then we're going to be focusing on the hamstring here, or the outer part of your hamstring, which is the vastus lateralis. This part of your hamstring is really, really important to foam roll. A lot of times people say you need to foam roll your IT bands. I disagree because the IT band is a band. You want it taut. What you should do is foam roll around the muscles encompassing the IT band. So this is the vastus lateralis. If you want an extra challenge, bring the opposite leg on top of the other one to add a little more weight. And then you can shift your angle. So moving a little bit externally and moving internally, feeling around where you're tightest. Now notice that I'm not vigorously rubbing up and down on that foam roller, side to side, up and down, all that stuff, because what that just does is it constricts the muscles, it contracts them, it makes them tense up, and we don't want them to tense up. We want them to melt, relax, open up. Very good. All right, we're going to go ahead and move forward now. Coming onto your hands and knees, we're going to bring the foam roller right into the hip flexor. So we're working on the rectus femoris. This is your quad muscle, and I like to start right at the hip flexor. So this is sort of the bottom of your psoas muscle. And when you start right at the hip flexor, you're really getting deep into the top of the quad, because when these muscles are tight, they pull up on that knee. So what we want to do is release the tension in the hip flexor and the quad. So I like to lay on this area because I'm generally always tight in this area. And any area where you feel extremely tight, like you have very dense fascia, you want to just literally melt the foam roll onto the muscles. So the muscles just release and relax. And then once it stops hurting, then you can go down another inch. So I like to move inch by inch, very, very, very slowly. And literally, sometimes I will spend 30 to 60 minutes on one leg. No joke. When I'm super tight, if I've gone on a long hike or a hard workout, I will spend an hour just on my legs. Making sure to breathe through any tense areas. If it feels extra tight, just see if you can relax the rest of your body. I know it's not always easy. And if you want more of a challenge, see if you can rotate that leg a little more external or internal and get a little bit of a various angle. And get some variety in your angle. When you feel relaxed in one part of your leg, roll forward and get a different part of your leg. And notice that we're rolling closer and closer to the knee. So if you do suffer from knee pain, oftentimes you will feel okay on certain muscles, but then once we get towards the knee, you're going to feel extra tight. And that's okay. Notice that. Because wherever you feel extra tight, it might not be the quad, maybe it'll be the calf. Just notice that that's the area you should be foam rolling most, because we want this area to be as soft as possible so your knee can move around freely. All right, let's go ahead and work our way towards the knee. And find the angle where you feel the most resistance. And take your time, move slowly. I can't stress the importance of moving slowly enough. Slowly, slowly, and deeply. This releases the fascia, melts the muscles. Foam rolling is definitely not something to rush through. This is something to be patient with. But if you only have 10 or 15 minutes of your day, then I would really focus on one muscle group, just so you can take as long as possible with this muscle. And rotating back, coming back towards the knee. You can lift up that leg from the ground, and then we'll roll off. All right, I'm going to show you guys one that can sometimes really hurt. This is working into the gracilis muscle. So this is around the sartorius. This is right on the inside of the knee. In fact, when I work on my clients in this area, they oftentimes wiggle around because it can be very tender. So be careful, be gentle, be slow. And if you want more of a challenge and go deeper, you can actually rotate that lower leg around and try various angles like this. Applying more pressure on the front or applying more pressure on the inside, just wherever you feel tighter. And as we foam roll here, we can slowly move it towards the inside of the leg, working our way up towards that hip flexor. Very good. Let's go ahead and move on to the calves now. So coming back on those sit bones, we'll sit down with the foam roller underneath the knee. We're going to go ahead and sit on the sit bones and work the opposite leg. Just like we started on the first leg with the hamstring, we'll do the same thing, working into the vastus lateralis on the opposite leg. Again, find your appropriate angle where you feel the most tension and work in this area. And if you want more pressure, you can apply the opposite leg to rest on top. Taking your time, breathing, melting. When we can melt through physical pain and tension, it's easier for us to handle the pain and tension that life brings us, sometimes emotionally, psychologically, spiritually. Always when we relax the physical body, we're allowing more receptivity in the emotional body and spiritual body. One thing always connects to the other. All right, going to the other side. Moving to the belly, we're bringing the foam roller underneath the hip flexor on the other side this time. And melt into this space right on that rectus femoris. Moving on to the quad. Again, if you don't feel much in here, try a different angle. Rotating that foot outward, inward. And if it feels like too much, see if you can just relax that leg as much as possible. And breathe. Slowly moving that foam roller down the leg towards the knee. This part always is a killer for me. That mid quad towards the knee is always a killer. So I'm just trying to breathe through it. Usually I will watch a funny show or a movie or something like that to distract me while I'm doing this, because just sitting in silence is a little challenging, but it's also a good meditation too, you know? But you could also write in a journal or play with your phone, just so that you have a little bit of a distraction, and it helps you stay on the foam roller longer. Sometimes I like to roll up way back where I was before, just to make sure I got it all ironed out. What we're really doing here is ironing out our knots, you know, and a knot's an accumulation of dense fascia. What that can do is cause stress on the meniscus and the knee. If you want more of a challenge, you can lift that leg up high and then lift the hips up. And then let's come down even further, closer to the knee. You might hear some gargling in your stomach as the muscles in your quad are associated with your belly, your stomach. So you might start feeling a little bit gurgly. And let's complete. Great job. Now we're going to the inside of that other leg. I know, our favorite, right? This one can be very, very challenging just because it's so tender. But I like to challenge myself and just breathe through it. Playing with those different angles. Moving in towards that hip flexor, playing with different angles by rotating that lower leg can help you release fascia where it needs to be released or discover new areas that you didn't feel before. All right, to complete our foam rolling session, we're going to go ahead and work on those calves. For some of you, the calves will be the most challenging part of this whole stretch. But what we're doing is putting the foam roller behind the knee, and this time going down and then foam rolling from the ankle up. Or you could foam roll from the bottom of the knee down. But I like to work my way up towards the knee. So starting at the ankle, because sometimes it'll surprise you that actually the fascia around the ankle is really, really tight. Maybe that's what's causing issues in the knees. When you feel an area of tension and tightness that's really, really challenging, see if you can breathe through it and try and relax the rest of your body. So it looks like I'm just chilling, but really I'm kind of in pain. But it's a good pain. Feeling that fascia release is always good. Let's go ahead and switch sides, starting at the ankle and rolling up towards the knee. If you want extra challenge, you can bring that opposite leg on top as per usual, adding a little extra weight there. as we finish off the foam rolling on our legs, I just want to acknowledge you for taking this time out, for watching till the end of the video, for taking time to connect with your body. Because a lot of people don't take any time, let alone this much time to just foam roll, you know? But this is why a lot of people end up opting for surgery or more drastic measures, or having an injury and then needing PT, because they literally don't foam roll or stretch. So the fact that you're interested in stretching and foam rolling speaks volumes to your commitment to your body and your health and wellness. If you'd like to connect more with me, then follow me on Instagram at Holistretch. And I hope that you guys feel so much better. At the very end is like the cherry on top. I like to foam roll my shins as well, but this can be very painful. So this is just a little bonus if you want to give it a try. Thank you guys so much. Feel free, everyone. Have a wonderful day. I'll see you in the next video. Ciao.